Hi everyone. So we're just going to give it a minute or two for people to join us. So in the meantime, we've got a little bit of a fun question up there. If you want to let us know if you had a superpower, what would that be? There's a little Q&A function at the top and that you can pop the answers in there. Okay, so it's just after 10, so we'll make a start and hopefully we'll have a few more people join us later on. So, morning everyone, I'm Sharon Reynolds and I'm the Senior Methodology Advisor for the Care Inspectorate. So today's webinar is going to be about introducing the revised quality framework for support services not care at home. So just making sure you're in the right webinar. And also our newly published self-evaluation toolkit. So we're going to talk a little bit about those today. So a couple of people have dared to tell us what their superpower would be. I'm always intrigued by that. Super irony, but what would be the point of that? Good one. Mind reading, yes. Although I'm not sure whether I'd want that all the time. Maybe I'd like to be able to turn that one on and off, just as and when it suits me. I think that would be a good one. Okay, so next slide, Anthony, please. So just a little bit of housekeeping. The webinar is going to run for about an hour and a half, depending on how many questions and that there is. We've left plenty of time for you to submit questions to us. There's a little Q&A function you'll just see up at the top of your Teams page there, so you can submit questions to us. We've left time between the presentations for questions and answers, so rather than answering them as we'll go along, we'll give you some information initially about the frameworks, and then we'll stop for some question and answers, and then we'll talk about self-evaluation, and again then stop after that for some question and answers. So we'll hopefully get through everything that people put into us, and after the webinar we'll actually produce some FAQs as well that we'll send out alongside the recording of the presentation. So this webinar is recorded. There's also the option for closed captions. You can access that in the bottom right of your screen. So like I say, please do use the Q&A function. Given that this is a Teams live, you're not able to speak, so we're not able to put your mics and cameras on for you to have a discussion as such, and the chat function isn't there, it's a Q&A function. So if you use that, like I say, we will engage with those at certain points throughout the morning. There'll be a link to a feedback form, which we'll share at the end. We'll put that into the little chat function so that you can do that. If you can do that before you disappear off the call, that would be great. There's only a couple of questions. It won't take you long. And like I say, we will make this webinar available afterwards as well. We'll put it out probably within the next provider update so that people that weren't able to come along will still be able to access it. Okay, so next slide, please, Anthony. Okay, so I'm going to talk you through the quality framework and the changes that we've made to that. After that, I'll be joined by Linda Taylor, who's going to talk to you about self-evaluation. And in the background, we have Debbie and Anthony, who are also from the methodology team, that are helping out with tech and answering any questions that come up if people are struggling to get online or anything like that. So what have we done and why did we do it? So we decided way back before the pandemic that we needed to review the framework. So the first framework that we did, which was for care homes for older people, was published in July 2018. We then published the support services framework in the autumn of 2019. So we decided that it was time to review it. You know, the initial framework had been out for over a year at this point, and we thought, you know, we need to get some feedback on how it's working in practice. So I'm sure lots of you were involved in our consultation when we initially developed the frameworks. But like I say, we wanted to see what was actually happening out there when it was being used in services and how well it was working. So what we've done since then is obviously gone back to that learning from the review prior to the pandemic, but also there was a lot of learning from the pandemic itself. There was lots of things that became apparent in terms of where we needed to focus our work. So we've also used that learning, and that's informed some of the changes as well. So next slide, please. So the review that we did just prior to the pandemic, we got in touch with lots of people via very different methods. We did some internal poll questions for our staff. We did Scottish Care consultation groups. We did focus groups. We did lots of social media polls and internal and external survey monkeys, as they were at the time, rather than Microsoft Forms. And 177 people responded to that. And people were very positive about the impact that they felt the frameworks were actually having on outcomes for people who use services, as well as supporting services to evaluate their own performance. Like I say, that key finding there was that the majority of people, believe that the frameworks support a focus on people's experiences and help improve outcomes for people experiencing care. Next slide, please. So what have we changed with this framework? What's new? So for a lot of people during the pandemic, we introduced something called Key Question 7, which was very specific to COVID-19 and the pandemic, and enabled us to go into a lot of services and do sharper, more focused inspections. We took a lot of learning from using that Key Question 7, and also all the kind of information that came out during the pandemic, and we developed a additional quality indicator, which I've highlighted on the screen there, 1.5, and that's all around infection prevention and control and ensuring that people's rights continue to be met when there's an outbreak. So different services, obviously, there was different impacts within this, and I'm aware a lot of support services, were actually closed and were not operating or operating very differently during the pandemic. We needed to look at how we could have a focus on infection prevention control and the impact that clearly has on people's well-beings without it being, the centre of everything. So what we did was we developed that 1.5 and we put it out to focus groups. So some of you as providers will have been involved in those, and some of you will have seen our draft framework. So hopefully you'll have had time to consult on that. So that's one of the main changes. We don't use like I say, the previous Key Question 7, but we do use now this 1.5. Obviously, infection prevention control's always been part of our framework. It's always been part of the core assurances, the things that we look at all the time on inspection. It's just a little bit more sort of focused now and a bit more sort of, out there. The other thing, one of the key changes is the scrutiny, improvement and support toolbox. So you'll probably remember your last framework had the long list of links to various different pieces of guidance. We've managed to change that now. So all those links are now in a virtual toolbox. So you'll see at the top there, it says key improvement resources are available on the hub. That link will take you to a dedicated page on our hub, where you can then pick whichever quality indicator and key question you want to look at, and there'll be an example of that on the next slide. So we've clarified a little bit around what it is we look for on inspection, what it is you should be considering when you're self-evaluating your service. Where are some of those sources of evidence? And that's about, breaking that down into what kind of things do you observe? What kind of things, should you be sampling in terms of paperwork? Who should you be talking to? What kind of things should you be considering? So we hope that that's made that a little bit easier for people to actually look at. Next slide, please. So this is what the toolbox looks like when you click on that link. So you're taken to this sort of home page where you then pick which key question it is you want to look at, and then that's broken down further into different quality indicators, and the links are then live. We've used this for about a year now. When we've been updating other frameworks, we've done this for all of them. We're just at the point where we're going back in now and looking at, okay, so what's broken, what do we need to fix, working with our improvement team as well to make sure we've got all the best resources and the most useful resources for people on there. So sometimes the links are broken, you know, that can't be helped. Things move, things change. You know, feel free to let us if you're finding that certain things aren't where we're telling you to go and find them. Drop our methodology team an email and we can fix that each time we update it. So hopefully this will be a much more useful kind of toolbox in terms of the most recent information, and it'll be able to get updated, and obviously is far more manageable than the pages of the big lists. So I'm a bit of a nerd around these, and absolutely love that we've done this with it. So I'm quite happy about that. Next page, please. So our core assurances. This is something that's new in terms of the framework, but it's not new in terms of what we actually do. So we decided to put them in so that people could see, you know, what it is that we looked at during an inspection. We always have a few questions around these core assurances, as in, you know, what do they look like? Why are they different to the rest of the framework? Are you going to be evaluated against them? Is it a new kind of inspection? Lots of different questions. But essentially, these are the things that we always look at on inspection and always have done. And over the years, they've been called different things. We called them must-dos. You know, there's all different things that we've called them over time. So we call them our core assurances because we know that they're the key areas that are essential to a service being safe, and that research supports that, which is why we call them those core assurances. These are really important to people's safety and well-being. And the reason they look a little bit different is that they're kind of that essential thing that's there, that non-negotiable, those things that maybe sometimes are quite process driven, but actually that's okay. You know, we can't always, you know, pop them into an outcome. You know, essentially all of these contribute to people's safety and well-being, but these are the things that, you know, are very tangible and have to be there. So, you know, we've written them slightly differently. And like I say, these are the things that all inspectors will do at all inspections. So regardless of whether they're coming and doing maybe 2 key questions, they will always look at this as well. And obviously these core assurances span the whole of the framework. But just because they're looking at a core assurance doesn't mean you're getting evaluated or graded on an entire key question. For example, we have a core assurance about staffing in terms of kind of recruitment practice is good, but that doesn't mean that we're going to be evaluating all of key question 3, which is how good is our staffing. But if we do find a concern when we're looking at that element, your inspector might then decide that, you know what, this needs a little bit of like further investigation, and they might then decide to evaluate, you know, more widely and look at that. Just depends what they're concerned about. So next slide, please. So, is there any questions around the core assurances or the changes to the framework? So we have one in the Q&A at the moment. Will there be a toolbox for care agencies? There's a toolbox for each quality framework. So all the registrations, all the services that are currently regulated have a framework, and all of those frameworks have a toolbox. So I'm not sure if you're talking about nurse agencies, they have a toolbox, like I say, every other regulated service also does. So I hope that answers that question. Like I say, pop any questions into the Q&A and we can answer them. So some of the things that people have previously wanted to know is about, you know, when does this start? When do we start using the new quality indicators? And that's a matter of, well, the framework is now published. I think that was published last week. So any inspections going forward will use the latest version of that framework. The indicators that people are looking at this year tend to focus around general well-being, so 1.1, 1.2, and 1.3. So people being treated with compassion, dignity, respect, getting the most out of life, the health and well-being. That's a focus for this year, as well as quality assurance. So 1.5 isn't specifically being picked to be looked at this year, but like I say, when people are doing their core assurances, if they're concerned about an aspect of infection prevention and control, then they might decide that it needs more in-depth evaluation, so they might decide to open that up and have a look at 1.5 as well. So it just depends on your service. One of the other things that you will notice, so Linda's going to talk in a minute about self-evaluation. What you will notice is that we have taken out all the boxes that were in the framework previously. So when we published the support services framework first time round, it was kind of a bit of a test in terms of having the self-evaluation boxes following each of your quality indicators and key questions to incorporate that sort of self-evaluation tool into your actual framework. People told us they hated that, so we stopped it. We didn't do that with any of the frameworks that came after that. We went down the route of creating these separate tools. So people told us that it made it too cumbersome, and in terms of printing it, it wasn't very helpful because it was in a PDF format. So we have changed that. We've taken all of those boxes out. And the tools are now all separate, and all the tools that Linda's going to tell you about are also in a Word format so that you can input into them much easier. So there's another question. I would assume no change to any of the supporting resources will change in the new framework. So it depends what templates you're talking about, David. Like I say, Linda's going to talk you through the self-evaluation toolkit. So the templates that were in, that I've just been mentioning, in the actual framework itself. So it is still those 3 questions, those 3 self-evaluation questions. That hasn't changed. It is still the same process. There's no difference with that. So hopefully that answers your question. Like I say, if there are any questions, feel free to put them in, because we can come back to it at the end as well. And I will hand you over now to Linda, who's going to tell you a bit more about our self-evaluation toolkit.
Hi everyone, a warm welcome. I'm Linda Taylor and I work as an improvement advisor with the Quality Improvement Support Team. And we've been working alongside our colleagues from methodology to look at the development of self-evaluation tools to support all services. So could I get the first slide, please? Thanks. So self-evaluation so far. The quality frameworks have been around for a while now, and there has been some adaptations, as Sharon's just discussed, due to COVID, for example, and the inclusion now of the core assurances as part of self-evaluation. All the quality frameworks will cover the same format for all adult services and include the self-evaluation toolkit, which works across the whole of the quality framework. So one of the purposes of the quality framework, therefore, is to act as a tool for self-evaluation. So what is self-evaluation? I'm going to talk you through the changes we have made to the updated version, and also how to use the self-evaluation toolkit in general. You will notice some green speech bubbles throughout the slides, and these represent feedback from providers who have been involved in testing some of the updated versions of the toolkit. So I think you'll find that quite interesting. Next slide, please. So this is a completely new template we have developed, reflecting the move to include the core assurances within the updated framework as mentioned earlier. Inspectors use a similar template as part of their inspection process. But this template is different to the rest of the self-evaluation templates, as we are looking at things that are core to providing safe and effective care at a basic level. It's a simpler, more concrete and evidence-based. So we're not asking you to seek feedback or evaluate where you're at with this on the evaluation scale for core assurances, because these are there should be embedded in your service to make sure that people are safe. So, for example, if you were completing the template under the heading of how can we evidence that we meet this core assurance, and say we're looking at adult protection, we would expect that services had processes in place that would cover all aspects of adult protection. So, for example, you might find that all your staffing is up to date. Your staff training is up to date, but that some of your policies and procedures need to be updated. So in the next box, in the box that's on the screen, under additional actions to be taken, you could add that the policies and procedures will be updated within 1 month. So it's quite a good template for putting that information in and what actions you're going to take. This template got a lot of positive feedback, as you can see from the speech bubbles, along with the idea of core assurances now being detailed in the framework. And I think providers capture it really well when they talk about being able to clearly see and evaluate themselves on the core things that inspectors are looking at that need to be in place. So some of the comments are, this template allows for capturing what is in place and what requires to be developed. This can also be shared with staff to complete and used as part of training for staff to ensure that they are aware of the key areas within the service. Someone else has written, I think the core assurances framework is also a very clear checklist for services to understand what is expected to be in place, and also captures lessons learned. Oh, next slide, please. Okay, so self-evaluation, the process. So the process for self-evaluation is based around 3 questions. The first question is, how are we doing? Now, this is the key to knowing whether you're doing the right things in the right way, and whether, as a result, people are experiencing high quality, safe and compassionate care that meets their needs, rights and choices. Scale is based on the words used in our grading scale. This also gives you an idea of the expectations within each of those evaluations as detailed in our quality frameworks. Second question is, how do we know? So how are you arrived at answer to question 1, how are we doing? Answer this question using evaluative statements based on the evidence you have gathered. You should use the quality illustrations from the framework and the health and social care standards and good practice documents as benchmarks, which may also help you think about where improvements need to be made. The final question is, what are we going to do now? So understanding how well your service is performing should help you see what is working well and what needs to be improved. From that, you should be able to develop and prioritise plans for improvement. These self-evaluation questions were actually introduced in the quality frameworks and also described in our guide to self-evaluation for improvement, which was published in 2019. These questions form the basis of self-evaluation tool, and you can see here an example of one of the key areas from the self-evaluation tool template. So for each key area, you would complete each of the 3 questions, and that would lead you to the identification of what is working well and where there might be areas for improvement. Take small steps and don't rush into it. Make it manageable. Next slide, please. I think one of the most crucial things about self-evaluation is getting feedback from people. The evaluation of your service, the how we're doing bit, should be in collaboration with the people who use your service, their families, friends, carers, the staff who work in your service, external professionals and other stakeholders. And this can be done in a variety of ways, for example, talking to people, having service events, focus groups, relatives, service user meetings or questionnaires. You need to consider the information you want to get from people, as this will influence the questions that you ask them. The example questionnaires in our toolkit are just that, examples. You need to consider what is important in your service and tailor questions so you can gain the feedback that you need. Breaking down the key areas for self-evaluation into smaller, more specific questions will help you build a picture of how you are performing across the whole key area. We have an example here of how you can break down the key areas into more specific questions for people to answer. This is useful to again tailor to your individual service and where you feel feedback is most useful to help you evaluate what is working well and where there are areas for improvement. You can use good practice guides and quality illustrations to make sure you're asking the right questions. By asking people to evaluate a key area using a scale, you can measure your performance in a more systematic way. By repeating these questions and the process at a later date, you will be able to measure your progress. Consider communication and how to support people give feedback, including the use of tools such as talking mats or symbols, but also use independent facilitation, such as advocacy. Comments from one provider said, it provides the opportunity for capturing views of those living, visiting and working in the service. Again, this can be used to capture feedback and would avoid having to devise new systems as they have been created. And by using the feedback templates, this will feed directly into the self-evaluation process. So all the tools and templates are there for you to use, but can be adapted, as we'll talk about later. Next slide, please. So how do we know? So now you have an idea of where your service is performing, you need to consider how did we arrive at our answer for question 1. This will be a combination of things, including the feedback you got from the various people and other quality assurance activities such as audits and observation of practice. Your quality assurance processes should help you identify areas for improvement as well as areas that are working well. This information can then feed into the self-evaluation as evidence for your assessment of where you are at. Remember to answer this question using evaluative statements based on the evidence you have gathered. You should use the quality illustrations from the framework, the health and social care standards, and good practice documents as benchmarks, which will help you evaluate where your service is at in relation to the required standards, and also help you think about where improvements need to be made. You can look at the scrutiny actions and improvement resources in the quality framework to see some examples of where you may find other sources of evidence of good practice. Key question 2, how good is our leadership, is the quality framework talks more about quality assurance with examples of what good and weak practice may look like and where you can find more information. Next slide, please. So what are we going to do now? By answering each of the questions, you will have identified where your service is doing well and where improvement needs to be made to support better outcomes for people using your service, which will support you to write your improvement plan. Planning for improvement, you will be able to see where the key areas for improvement are, and then in consultation with those who use the service, agree a plan for priority areas. What is important about this improvement plan is that it designates responsibility and a time frame for completion. The improvement plan should always include the actions, be specific, the timetable, who will carry them out, and include a review of what was achieved and where further action is required. The manager retains overall responsibility for the completion and review of the improvement plan. This should be available in a format that you are able to share. This tool should be used as part of your normal participation and quality assurance work within your service. You should aim to review this plan regularly and ensure that the information is accessible to you and to share your plan with other people who use your service, stakeholders and staff. The participation of stakeholders, people experiencing care and their families is an essential part of the review process. Services can then share this with their inspectors, as inspectors will be keen to see your improvement plans. Once plans have been actioned and achieved, the tool can be repeated to see if the evaluations have moved. Remember that self-evaluation is a continuous process to improve your service. It's not for the Care Inspectorate. There's lots of other information and improvement tools that can be found on the hub. Next slide, please. Barriers to self-evaluation. We appreciate that COVID-19 pandemic has significantly impacted the capacity of services to undertake some of their usual processes, and never mind looking at new ones. With this in mind, we have suggested a summary version of the process that will support those who have extremely limited capacity, but will still offer some of the benefits of undertaking the process. For example, use what you have. Use requirements, areas for improvement already made, and then plan how you will address these. You might already have ideas and areas of improvement that you want to put into your service, so start with these. Use parts of the process that suits your needs. For example, just focus on one key area or one quality indicator. It's not an all or nothing type of process. And a comment from one of the providers is that the benefits of self-evaluation can be used as a whole, or you can choose which elements would be beneficial at that time. So it's up to you what you want to choose. Next slide, please. So this is just a general overview of the package that has been put together. So there's the self-evaluation tool and guidance document. There's templates for the core assurances and for improvement plans. There's a self-evaluation tool that you can use. And there's a worked example that gives you all the ideas and how to put it into practice. There's an example plan for holding a focus group. And there's also example questionnaires for people who use the service, for relative staff and visiting professionals and stakeholders. And these are all available on our website. And as Sharon said earlier, the tools are in a Word format so that it can be copied and adjusted for your service. So remember, these are just examples and they should be tailored to meet your individual needs. Next slide, please. These are just some examples of the feedback we've had from some providers, which are all very positive. One provider said, "I've found that I immediately reviewed my own questionnaires to simulate the documentations provided by the Care Inspectorate with a minimal amendment by implementing pictorial effects for residential questionnaires." Someone else said, "I particularly like this tool for a multitude of reasons. It's a Windows document that can be easily amended to suit any provider's needs. It can be amended to suit what area of the quality indicator is being evaluated. There is a development area in the back page to include your development plan. It's easy to understand and it's manageable. And I find this tool to be very useful as a standalone provider." So it has lots of benefits. Next slide, please. So where to start? It may seem self-explanatory, but a good starting point is to read the guidance. This will also signpost you to additional guidance, such as our guide to self-evaluation previously published, as I discussed earlier. There's also the model for improvement and other quality frameworks that you can look at. Having read the guidance will help you understand the process as a whole that we are talking about and consider what you already do or have in place in your service that contributes to identifying what works well and where there are areas for improvement. Remember, the use of this tool is not mandatory at the moment, but is helpful in either starting or supporting your own processes to enable effective self-evaluation in your service. Next slide, please. Has anybody got any questions? No.
Thanks for that, Linda. Some of the questions that we've previously had focus around that bit that Linda was just mentioning there about the self-evaluation being mandatory, or are they going to be asked to submit it, things like that. So just to let you know, like Linda said, at the moment it is not mandatory. There are currently no plans for your self-evaluation to be submitted or to make it mandatory, but this may change. But what we do want to say is, these are things that we have designed to be helpful to providers. Now, you may have your own version of self-evaluation, your own quality assurance processes that are in place and working wonderfully well. That's fine. You do not have to use what we are giving to you. We're giving it to you to be helpful, to give people who are struggling an idea of where they can start and how they can start. So this is about kind of a supportive function. There is an expectation that you self-evaluate your own services. That is part and parcel of your quality assurance processes. You should be doing this anyway. So, like I say, whilst the actual act of self-evaluation, is really key, and there's an expectation we do that, it does not have to be in the format that we have done it. One of the things that is our core assurances that we would always look for in a service is that service development or service improvement plan. Different people call it different things, but essentially that thing that tells us that you look at what you're doing and make an evaluation of that. So whether it's different audits or bigger pieces of self-evaluation work, feedback from people that use your service, that you're doing something that highlights that where things are going okay and what are the things that you need to work on, and you then building that into some kind of action plan that you're taking forward. So that identification of, yes, we know we need to work on this and this is how we plan to do it. And that's kept live as well, that improvement plan. So, it has to be a live document that gets reviewed, gets updated, has input from different people. So those kind of things we do look for, but again, they do not have to be in our format as long as it does the job that it needs to do. That is absolutely fine. You can use whatever it is that you have within your service that is working for you. We've had a lot of positive feedback. Linda was saying there was some comments there were from when we first tested the self-evaluation framework toolkit rather. And, we've since been hearing different things from various different providers, from partnerships who have taken up some of this approach as well to using the toolkit to support services that have been struggling and found it very useful to have that format. They say we just want people to be able to see that value in actually doing the self-evaluation, taking that first step and building on that. There's no time scale. You don't need to do it, every couple of months or every year, or, basically do it whenever you need to do it. There's no expectation of how often it has to be done. Again, that evaluation of your own service and your own performance is an ongoing process. Your quality assurance processes are always happening or should always be happening. But it might be you're focusing on something that needs to improve at one particular point, so you maybe don't focus on other things. You maybe pick and choose. And that's the beauty, I think, of the toolkit, is that you can pick whatever elements of the framework you feel are important to you to look at any point, and that expectation that you amend those templates to focus that for yourselves. It's not a case of just copying what we've done and the questions that we've proposed, in the frameworks. They are just ideas of the types of things across the framework that you may want to know about. but there is an expectation you just amend those to suit yourselves. So we had a couple of questions. So somebody's put in that we don't deliver healthcare as not a nursing agency. Our service is social care. So would this be about medication or health and wellbeing activities? Not quite sure what you're saying there. Obviously, all the services we regulate are social care services. We don't regulate healthcare necessarily, even though we regulate nurse agencies. So anything we have in the frameworks or in the kit, the self-evaluation kits, is all about people's health and well-being, and that, you know, is quite holistic and broad, depending on what your service does, what are the aims and objectives of your service. So it may be about medication, it may be about mental health support, it may be about supporting people with addictions. There's a range of things that people are going to be supporting with that aren't about separating that out into, you know, just healthcare or just social care. It's about whatever your aims and objectives of your service are and what you support people with. Most people are supported, or most services rather, support people with things like medication, maybe peg feeding, things like that. So, you know, I hope that that answers the question. If not, just pop something else in there. You said it wasn't mandatory at the moment. Will it be? We are doing work into self-evaluation and what that could look like. So historically, we always had a self-assessment. We do not want to replicate that because it didn't really work for anybody. So providers spent huge amounts of time writing these massive, you know, huge efforts at self-assessment, yet it didn't really produce what it needed to in terms of supporting improvement or supporting to people to really know where they were at. People were writing it for us, and maybe what they wanted us to know about their service and what they, you know, didn't want us to know wasn't there. Things weren't properly reviewed. You know, people were talking about things that had happened many years ago rather than it, you know, being a live document. We do want to have some form of self-evaluation work, you know, in terms of kind of our scrutiny approach. What that potentially looks like, we don't know. This is the first step. This was always the intention, that, you know, the primary focus of the quality frameworks were always as a tool for self-evaluation. That was it. You know, put out there what the standards and expectations are, and then support people to self-evaluate against them. So that's the point at where we are. Depending on how well people do this, depends on the next steps. You know, is there room for people to use this as part of a scrutiny approach? You know, will this adequately support improvement, or do people need more input? I know certainly Linda has done some work with care at home services around what else do people need to effectively do self-evaluation and do it well. So there's, you know, self-evaluation is there at the forefront of our mind because it's something that really promotes services being able to improve themselves without having to have us kind of do that bit of work for them. It's not about us coming in and telling you where you're going wrong. It's about you identifying where you're going wrong or what you're doing really well. So when we've said, you know, it's not mandatory at the moment, that's because we just don't know. So rather than saying yes, no, it'll never be mandatory at all, we're never going to ask for it, we might not. You know, we just want to kind of be honest about that and not sort of set anybody up to think, well, you know, no, it won't be. But whatever happens, there will be engagement with the sector and people will know about what is happening and why. Is there a way to improve ease of access to these documents? I've been looking through the website, trying to find these during the webinar. It's not easy. People say that all the time. I think on the web is the easiest place to find them. So there's a publications and statistics part of the web, so you can go straight to that rather than searching. We know the search function on the web is not great. So if you always head to the publications and statistics, and under professionals, then there is a heading for quality frameworks, and all the most up-to-date quality frameworks are in there. and all of the self-evaluation toolkits, they each have their own heading, which is just under, I believe, quality frameworks as well. So that is the easiest way to do it. Our comms team are looking at building special place, for want of a better terminology, on our hub, so that again they're all together and all in one place. But again, we know that search function within the hub isn't always great either, so we want to make sure that, you know, we're not just kind of putting them somewhere that's just another place that people can't find them. So yeah, hopefully like the web will be easier for you to find them, but we are working on that as well in terms of making it even easier for people to get to them. Does the framework replace the care home framework? No. Like I said, each framework has, each registration category has its own framework. So care homes for adults and older people have their own framework. So that used to be two separate frameworks, but last year that was when we updated the framework, it was put together, and that was based on feedback from providers that said that was their preference, that we actually made it one framework. So the care homes for adults and older people is completely separate. So Linda's mentioned there that the improvement team are working on bite-sized videos for self-evaluation, which would be really useful. So yes, you will not be able to find the updated framework on the hub. It is on the website, because that is the easiest way to find it at the moment. Like I say, we are building a separate place within the hub where all the frameworks and all the self-evaluation will live. Linda's also put in there is a separate improvement section which talks about the model for improvement and some of those things that you'll find in our self-evaluation guidance. She's put a link on there to that section. So the previous slide asked how good is our healthcare, but you have answered now by saying it's more about health and well-being. Okay, yeah, I'm not sure what, I'll have to look back at the slides because I'm not sure about that. It should be how good is our well-being, or how good is our care or staffing or whatever it is. So that might just be an error. I would have to look back because that shouldn't be. So thanks for highlighting that. So a quality framework for care homes was published on 19th of April 23. Yes, that is true, and I did raise that. Oh, right, okay. So what happened there? So somebody's saying the framework for care homes and adults and older people states it was published on 19th of April 23, yet the actual document is from 22. So that was a couple of days ago. So there was an update to the core assurances for care homes, just for care homes, which is why that 2023 date is the update. So the actual document itself, yes, came out April 2022, but this week we have added an additional core assurance around Anne's Law and Meaningful Connections to the care homes for adults and older people only. So that was updated this week, and a piece of information went out, I think, prior to that to providers to warn them that this update was coming, so they were aware of that. So hopefully that answers that question. That's all the ones I can see in the Q&A. If anybody has any more questions, feel free to ask. I think Anthony's going to put in a link to our evaluation form, which if you can fill in before you dash off, that would be greatly appreciated. What I do want to say is thank you everyone for coming, and also thank you to those who engaged in our focus group and also gave us feedback on the changes that we were making. You know, it's really important to us that people are involved when we're making changes and doing things, because, you know, we want to work alongside providers and make sure that we're getting these things tailored, you know, right. So if you do have any questions, you can see an email address there, methodology@careinspectorate.gov.scot. So you can drop us an email and ask us any questions if it's not something you want to put in the Q&A here. You can also just contact us at any point asking us really about anything related to methodology. We are a fairly new team. We've only been in place for the last couple of years. So like I say, please feel free to get in touch with us. I can see, just check. Right, so will the PowerPoint be shared? So the slides and the recording will be shared, but we will be doing that. We will be doing that via the provider update as well. So keep an eye out for that. So the recording of this and the slides will be shared, as well as the frequently asked questions. So we'll use some of the ones, because we haven't had many questions for this session, so we'll use some of the ones that we've had previously to give you an idea of some of the other things that people have maybe wanted to know as well. Okay, well, like I say, we appreciate your time, and we've given you a little bit of time back there because it's been fairly quiet today. So thank you very much for coming, and we'll look forward to hopefully engaging with you soon. Thank you. Bye.